Should I get malar, submalar, or combined cheek implants? Which procedure gets better results for increasing collagen and reducing shadows under the eye? I don't have very defined cheekbones, aging and looking more flat in this area, and my nose is looking bigger. Want permanent, no fillers. My face is pretty long and narrow. I want the implants to match my long, narrow face, not overwhelm. But I'd really love round, youthful cheeks, especially under the eye area. Feeling it's starting to fall flat now from below the eyes towards my chin and lips. The side of the face could be enhanced as well. Youthful and fuller rather than chiseled would be my goal, and improving overall tightness and texture of facial skin.
Thank you for your question. You submitted your question with several photos, and you're asking, should you get a malar, submalar, or combined implant? And you're stating in the details of your question that you want something permanent and you don't want fillers. And that you stated that as your face has been aging, that the nose is looking more prominent. And you're describing that your goal, which is to have a more youthful, rounder look and not so chiseled, but it has to look natural with your thin face. Well, I can certainly share with you some basic concepts of how a surgeon determines what kind of implant is appropriate for a patient, as well as some perspective that I think is important that maybe has not been fully discussed with you to this point. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping patients like yourself with facial aging changes through different surgical and non-surgical approaches has been the core of my career in the past over 20 years. And certainly I can share with you a little bit of the evolution of my thinking and really what has become more of an approach that I think will be relevant to your situation. So part of the challenge is that you are dealing with results of facial aging, which is progressive. Yet you want something permanent. And understanding that facial aging from a global perspective, what you're mostly experiencing at this point has to do with a relative diminishing of bone volume. So, of course, it stands to reason that placement of an implant will make sense. So to distinguish the difference between a malar, submalar, and combined implant. Well, the malar implant is basically aimed towards increasing the projection of the cheekbone prominence, or an area called the malar eminence. The submalar implant is to fill that area below the cheek, called the submalar area, and then when you combine the two, you get an implant that does both. Now the challenge in your situation is how can an implant be placed that will not look so chiseled and be rounded and look harmonious with your face? I think from a surgeon's perspective, there is a leaning to do something more conservative, because for a person with a thin face, you're going to avoid that disproportionality which can appear to look chiseled. The surgeon will lean towards placing a smaller size implant, regardless of whether it's a submalar or a combined implant. If you were to do only a malar implant, I think you would probably just feel like the chiseled look would be accentuating the thinness of your face. Now, when dealing with this type of challenge has become different in my practice based on the introduction of several things. One is the use of long-lasting fillers such as Juvederm Ultra Plus and Juvederm Voluma, and a technique called structural volumizing. Now, structural volumizing allows me, with my surgical background and surgical knowledge, to make corrections of these areas of deficit in a person's face, not only in the cheek area, but in other areas of the face, such as the chin and the jaw angle. If you want to get a more softer look overall, then I recognize the resistance to wanting to do fillers with some regularity. Patients frequently ask about doing something, quote, permanent. But recognizing that aging changes is not only bone loss, but muscle, fat, soft tissue, and that the skin gets thinner with time, then there's a challenge with putting an implant when the soft tissue overlying that implant is going to continue to thin. And this is an issue that, of course, is discussed before doing an implant placement. With structural volumizing, I've been able to place these long-lasting fillers in a way that I'm able to control. So I can compensate for asymmetries, and I can also place in multiple areas. A lot of times when I show a patient a before and after of a structural volumizing patient, I further explain that to get a similar result, I would have to place a cheek implant, a chin implant, and a jaw angle implant, which is considerably a lot more surgery. Further, because I'm able to really control the amount and volume of placement, it really makes this an ideal. And I can certainly tell you that more people are more comfortable with the placement of long-lasting filler than doing a surgery and taking the risk that they'll still need filler afterwards. And this is an important point. When you have a facial implant, it only addresses a limited area, albeit an important area, that will help you look better. But when you look at your face, you want to look at the balance, the harmony. That is very important to look youthful. And there are many elements to that. So I think that it is important that as you do your consultations, you get a realistic understanding of what the outcome will be. The last thing you want is to go into the surgery with this expectation that this will be the definitive procedure that'll bring harmony to your face, and then have to still do fillers. So it's important. And I tell this to my patients who also I do facelift for. When patients come and say, well, I want to get a facelift so I can look young for a long time, I say that a facelift will help you restore the position of the cheek and improve the jawline and neck, but it doesn't negate the need or displace the need for fillers. Understanding that facial aging is volume loss and descent, you want to address all those elements to get balance and harmony. So it has become my practice, even though I'm a surgeon and I love doing surgery, to guide my patients based on the tools and the outcomes that I can achieve, which I feel are exceptional using structural volumizing in the course of what is no more than 30 minutes, that essentially has replaced what I used to do with surgery. Now, it's not the case for every patient, but certainly a lot of people who we're seeing in our practice choose that option. And the fact that these fillers can last up to 2 years makes it fairly easy to do. Now, a lot of times people need fillers in other areas. Facial aging is not limited to the area that bothers you. People want volume in their lips. People want volume in the more superficial lines and other areas. So we really have a wide range of fillers and different techniques to deliver those fillers to get a look that is customizable in real time. And I think that's important to consider as you're making your decision and strategizing in dealing with your facial aging changes. So I hope that was helpful. I wish you the best of luck. Thank you for your question.